We're happy to have Dr. Kat here today in Southern California, chatting with us about perinatal mental health. She's a perinatal mental health psychologist. Thank you so much for joining us today, Dr. Kat.
Thank you so much for having me. I'm really glad that you guys are focusing on this. It's such an important topic, and there is so much to know. So I'm glad to help people start to understand what this is all about and what might be going on for them.
Awesome. We'll jump right into it then, Dr. Kat. Could you start by telling us a little bit more about your practice and about yourself?
Sure. Yeah, I am in private practice and I see people online in California only. And I've been specializing in perinatal mental health for over 12 years now, but a psychologist for longer than that. And within my practice, I do therapy, psychotherapy with people, one-on-one over uh, online. But I also host my own podcast all about perinatal mental health called Mom and Mind. And it's really focused on people sharing their personal stories, things that they've been through, and then sprinkled in are some expert interviews with uh, clinicians, psychologists, researchers who share information about, different kinds of conditions that people experience.
Mm.
Um, and additionally, I'm in the new board chair for Postpartum Support International.
Oh, nice.
That's
Wow.
a little bit about a little bit about what I do. I sort of breathe, eat, swim, live in perinatal mental health world
Yeah.
because I want to. I'm super passionate about it. In part because the 12 years ago when I started in this work is when I went through it myself. I had postpartum depression, postpartum anxiety, and postpartum OCD, all of which were things I didn't expect. And I was already a psychologist and didn't have any training in this
Wow.
or to know the signs of what was going on. So once I figured out what was going on and started, getting better myself, I sort of made it my mission to be as loud as I could
Yeah.
about all things perinatal mental health because I don't want anybody to go through it. It's really rough, and I didn't know about it, and I was a psychologist already, and figured, well, if I didn't learn about it, how are other people learning about it?
Yeah.
So here we are.
That's great. Yeah, I find this whole path of women's health is often from a personal experience that you go through and then you
Yep,
share about it. And yeah, it becomes a real passion
absolutely.
connecting that way.
Yeah,
Yeah.
absolutely. Same
Yeah.
feeling.
Nice. Um, you did kind of touch on this briefly already, but was there any other parts of your life or experiences that made you interested in going down this path, or like was it more of a personal start that kicked it off?
Initially, it was the personal
Mhm.
start. I mean, the, I've always wanted to be a psychologist since I was young, like 12, and I knew that on some level this was my path to be helping others.
Mhm.
Um, but I had always had this feeling of like I don't want to be a generalist. I want to find something that is really I'm connected to and that I can really help people with. So it found me, the specialty found me in that way. So once I dug in a little bit and understood just how many people are affected by this, I just I don't know how else to say it, but I became really angry that we're so many people are dealing with this and don't know what could happen to them and don't know how to get out of it sometimes. So yeah, initially that was the spark was mine, but once I got into it, I just realized there was so much to be done to help
Mhm.
other people.
Mhm. Nice. What are the most common mental health challenges that you do see during pregnancy, and how do those differ from what you see postpartum? Because
Mhm.
I know you support families going through both. So,
Oh,
what
for
are
sure.
kind of the most common, yeah, pregnancy and then postpartum?
Yeah, I think a lot of people have heard about postpartum depression and kind of don't realize that there are a lot of other things that can be going on. And specifically during pregnancy, there's a lot of anxiety. And for some, for, you know, good reason, in the sense that you have a reason to be worried if you have any medical complications, or if you're going through things like hyperemesis, which is the not just morning sickness, it's the really throwing up a lot, and that can get very serious. Um, so there's medical stuff there, you're checking on baby all the time, having checkups, and it can get really, because pregnancy is so literally internal, like what is going on is happening within you.
Mm-hmm.
It can sometimes feel a little bit lonely, like if you're worried or thinking about baby a lot, or trying to manage whatever is going on with you internally, but also externally, if you have work and relationships, and
Right.
essentially you're in the process of your life changing pretty dramatically, going from potentially this being your first child, or even if it's not your first child, things are about to change, and they're changing within you internally. So I think it's sort of naturally, psychologically, it brings up some stuff. You have hopes, you have dreams, you have wishes, and for some people, especially if they already have a history of anxiety, pregnancy can really expand that.
Right.
And so, yeah, the anxiety can be there for sure. Depression is there too.
Mm-hmm.
Again, I kind of touched on it a little bit, but if you have kind of a predisposition, if you already have had your own mental health conditions that you've managed, or it runs in the family, you might be more likely to experience that in pregnancy or postpartum, or both.
Mm-hmm.
Um, but yeah, anxiety is not talked about enough. I can say that, for both during pregnancy and postpartum.
Mm-hmm. Why do you think that is? I often see more conversations around postpartum
Mm-hmm.
symptoms, but
Mm-hmm.
not that much around what women experience during pregnancy.
Mm-hmm.
Is there like a reason that you can see for that?
Yeah. There are some that are a little complex, and we could go on forever about it, but I'll touch on a couple of things. One is there's like a societal pressure and kind of myth, if you will, about what pregnancy is supposed to feel like and be like.
Mm-hmm.
For instance, you're supposed to be excited. You're supposed to be happy. Somehow you're glowing also. There's this pressure to be in this mental emotional space where you're just so thrilled and so happy, and that comes with a lot of pressure. And I will say that for some people they do feel that way, and that's a genuine experience for them.
Mm-hmm.
But if you don't feel that way, and you have that kind of hitting up against this societal expectation, or maybe even something you grew up hoping you would feel like, and be like, and you don't feel like that, it can feel really isolating,
Mm-hmm.
and make it even harder. People will often say things like, I don't know why I don't feel that way. I
Mm-hmm.
wish I could feel that way. I feel bad even for not feeling that way. I'm supposed to be happy. So those kinds of pressures, um, I think, silence people quite a bit. So it's becoming more and more common to talk about how emotional stuff and how difficult pregnancy can be. But for a long time, there's a lot of history around women just kind of being told they'll be fine. It's just pregnancy. You're emotional, and that's because of hormones, and kind of dismissed and whatnot. So people historically have either suffered in silence, or just not felt like they could be honest about what pregnancy is like for them.
Yeah, absolutely. Thank you for that. So, I think what we see a lot is, postpartum depression being like the most
Mm-hmm.
commonly talked about symptom of perinatal mental health.
Yes.
Um, but there are more severe cases of perinatal psychosis. So how do you, as a psychologist, distinguish between those cases? And like what are the signs where women might need to seek help because it's something more serious? Yeah, can you comment on that?
Yeah, absolutely. So to your point, there's a range of things that people can experience, from depression and anxiety to OCD to trauma, PTSD, um, and also bipolar disorder, sometimes onset or exacerbation. And then to what you were talking about, postpartum psychosis. I think it is incredibly important to differentiate between the two, not because, you know, certainly they can both be very severe, but in media in particular, if like somebody who's experienced a postpartum psychosis, and it has, I guess, ended up resulting in something really severe or some really bad outcome, um, like the mother or child being injured or dying, to be frank. In the media, it's often called postpartum depression, which is not accurate. It's usually a case of postpartum psychosis, the more severe ones. And I want to be super duper clear that postpartum psychosis is severe, but it's not always resulting in something, happening to the child or happening to the mother in terms of like a bad outcome or someone dying. Most cases of postpartum, well, a lot of cases of postpartum psychosis are not that. So in the sense of there are quite a few different symptoms that we're checking for and looking for. Postpartum depression, the mood tends to be really low and might feel sad and tearful, not have motivation, eating patterns change. They might, have feelings of hopelessness or worthlessness, and just not feeling like doing things that they used to enjoy doing. So the symptomology, or what I'm seeing, is somebody who's really down, very, very down. With something like postpartum psychosis, the symptoms, and I'm kind of using broad strokes here. There's more nuance than I'm going to be able to give you here. But postpartum psychosis can involve a sense or a feeling of like going in and out of, like, I guess, reality, for the sake of our conversation. They have symptoms that wax and wane. So at times they could be experiencing something like a hallucination, whether that's auditory or visual. So experiencing something that's not there, that with the rest of us don't see. They might be having delusions or things that are feelings that, how do I express it? They might think that they are something that they're not, or feeling, like they can do things that they normally wouldn't be able to do. And this is me sort of like looking towards them, and not speaking of the internal experience for this point. But like behavior might be odd. They might be doing things that they don't normally do, saying things that they don't normally say. And it's quite scary for them, for people who are experiencing it. And so anyways, I'd say the hallmark difference would be that, when somebody's in a psychosis, they don't necessarily know that they are, if they're deep in it. They just can feel like the world around them is either not safe, or they might feel paranoid. So there's a really different and distinct feeling, that I have as a clinician. I'm sitting with people who are dealing with psychosis. Yeah. So, I mean, as I said, there's so much more I could say, or nuance to understand about it. But I do think that what I do know for sure is that, all of it is highly stigmatized. And so people often don't seek help because they think they're losing their mind. And it's, if we could have more compassion for people who are going through a psychosis as opposed to judgment, I think that would go a long way in making sure that people get the help that they need.
Absolutely. Yeah, thank you for that response.
Mm-hmm.
Um, I'd love to talk about the correlation between body image and a healthy mindset during pregnancy, and postpartum.
Mm-hmm.
So, how commonly are perinatal mental health issues rooted in thoughts about body image, and how can people go through these challenges and be supported?
Yes. Again, there's sort of like a spectrum or a range of experience. Uh, People really are, their body is changing, and it's sort of strange to have, it can be a strange feeling to have your body be changing. Um, so some people love pregnancy and love how they feel in their body, and love that, they're growing a human and they could feel that. And Other people, I would say, in particular, for people who have a history of, let's say, an eating disorder or disordered body image, um, going through pregnancy can be really challenging, because it can feel quite different than the example that I just gave. It can feel like your body is changing without your permission, or you're get for I'm thinking in particular of a couple of women that I have supported who do have a history of disordered body image and eating disorder, is that the physical discomfort of having your body change where you can't fit into things that you used to, or that you're worried about the judgment from others, or even your internal, your sense of yourself is even more judgmental. So again, that's kind of somewhat two ends of a range. Some people absolutely love it. Other people cannot wait to not be pregnant because of how they feel in their body. And then, there's a lot of in between that. Right. So people have a certain relationship with their body pre-pregnancy. And then that shifts and changes during pregnancy and then in postpartum.
Mhm.
Um, there are so many ways that, you know, mm, how can I say, again, I'm going to go to the societal impacts of, let's say, like diet culture and
Yeah.
um, social media, and ways that women's bodies or pregnant people's bodies are portrayed. Um, that, you know, I'm just thinking of like images that I see of like these perfectly round bellies that are all like shiny with, you know, and tanned and whatever, um, that we might have an internalized idea of what we think our pregnant body should look like. And if it doesn't look like that, people have to end up dealing with um, feeling or looking like in ways that they didn't anticipate.
Mhm.
And what's hard about it is that you don't know how your body's going to respond to pregnancy until you're pregnant, and what it's going to look like until your belly starts growing. And because everybody carries differently, or uh, even for women who are plus size and going into pregnancy, they might be dealing with, oh, I can't have that perfectly round belly that everybody tells me I'm supposed to have. Um, it becomes so complex. Well, where we are in our bodies, and when they're changing, we're having to change with it. So it can be some time before, for people who are struggling, anyways, before they feel okay in their bodies and with their bodies. And that can be a little bit more challenging postpartum too, because of this kind of, again, I'll just call it like a bounce back type of a um,
Yeah.
idea, that your body is supposed to go back to something that it can't be or won't be, because you have changed. And I'm not necessarily saying you can't like be in shape if you want to be in shape, But again, it's a pressure that somehow we're supposed to magically have our bodies return to a pre-pregnancy body, um, with, I don't know, immediately. Just it's hard. Your body does what it does, and it's a process to learn to accept that and be okay with it if possible. But there are resources out there definitely for people who are kind of struggling with body image and how they feel within their body. Um, but I would say it's a process. And for anyone who's listening, I guess if you can be as kind and compassionate to yourself and your body as possible during the process, it will ease a lot of that discomfort.
Thank you for touching on the media and its um, distribution of these ideas of perfect pregnancy bodies, because we all are very much aware that that goes on in our culture,
Yeah.
especially geared towards women, but we don't talk as much about how it's geared towards pregnant women too, and that's a really interesting point. Yeah.
Yeah.
How does grief from pregnancy loss, or birth trauma manifest in feelings that women have about their own body image and coming out of that, pregnancy, going through pregnancy and postpartum, having a loss or having this trauma? How do you often see that come through in women's emotions, and how do you treat it?
Oof, yeah.
Big question.
Big question. There's a lot. Um, there's a lot in there. Mm, whether people have had one pregnancy loss or multiple ones, or birth trauma, it really does impact relationship with the body and how people feel about their body. There's often a feeling of betrayal, like that their body didn't do what they wanted it to do. And for birth trauma in particular can be really complex, and it is complex because there's so many factors that could be going on that contribute to um, how you experience the birth of your child or the trauma related to it. Um, and sometimes pregnancy loss is traumatic in itself. Um, so I guess sometimes people, like I said, feel betrayed a bit by their body. That sometimes they don't feel like they can trust again their body to do to be pregnant, um, to have a pregnancy that goes to a full term. It creates a lot of anxiety, loss and trauma. It creates a ton of anxiety, because I mean, if you think about it, you go through something that's so devastating and um, puts you in a process of grieving what you wanted, which, a child, or grieving the birth that you wanted, which, obviously everyone wants a smooth, easy, beautiful birth. Um, and if those things don't happen and you are, trying to be pregnant again, um, you will have a lot of anxiety going into it because the anticipation, you don't want that to happen again. So it creates a natural amount of anxiety. Anybody would feel anxious after that. Um, so in some way, the grief from pregnancy loss can be very different than the grief of a birth trauma, birth related trauma. So the treatment approaches might be different. And I'll just give you a for instance. I guess specifically with pregnancy loss, when somebody is pregnant, they begin naturally to like think ahead, hopes, dreams, specific dates, having like an estimated due date, having certain dates in mind where you have your 20-week scan or whatever it is. you're thinking out into the future and starting to plan for to have a baby. So when the loss happens, you're grieving the loss of the child, but also the loss of your hope for the future and all of the places where you might have like put or had images or thoughts or hopes of having your baby or your child in the future. It's a very it's a grief that's different from other types of grief. So that working through that type of a loss, you know, some of it is walking through that the difficulty of when that estimated due date comes and you are grieving that date and the day that you had hoped for your baby to be there. So a lot of it is walking through that emotional, really complex emotional pain that can feel all consuming. It can be really hard to feel like how am I going to get to a place where it doesn't feel this bad all the time? And it you have the additional pressure of people feeling, let's say, like 6 months on, that you quote unquote should be better by now. Or those types of pressure that you start to get from other people is another factor in loss. And what I can say is that, grief doesn't end necessarily. It's not like you get to a point where you don't care anymore. You're always going to feel the pang of that loss. But you do get to a point where you can, with it, like walking through processing the grief, understanding why you feel the way you feel, you can get to a point where it doesn't feel all consuming anymore. Where you can kind of, where those dates kind of come and go, and you ideally, if needed, we're creating, and this is through therapy anyways, if you need some kind of memorial or ritual around that date, or and not everybody wants that or needs that, but sometimes focusing on being able to honor your baby can help. So I mean that is just like a little bit of a glimpse into a therapy process for pregnancy loss. For, if I can, then for birth trauma, it will be different. It can be different. Sometimes I also do EMDR. Sorry, just a second. Okay. I also do EMDR with people, which is a type of trauma therapy, eye movement desensitization and reprocessing, which can support people to move through the feelings of trauma so that it doesn't feel as intense for them. But yeah, I don't know how much you want it to get into that, but the process for supporting somebody through something like birth trauma is to first help them like kind of regulate their body and their emotions can be really, I don't want to say all over the place because trauma is so different for everybody, but essentially we're trying to lower the intensity of what they're experiencing and reduce the fears that come with trauma. Like, yeah. So without getting into like a bunch of detail, that's what I can offer there.
Totally. Thank you for that.
Mm-hmm.
Yeah, there's a lot of things that are coming up for me while you're talking about this.
Yeah.
I personally went through a loss at 5 months into
Mm.
pregnancy.
Mm.
So
So
that's how I
sorry.
ended. Thank you. That's how I ended up with Nyssa. So I published poems and through Nyssa, and
Mm.
it was all about my experience with the loss. And I think what people don't realize is how much your body actually changes going through these things the same way
Mm-hmm.
it would as a pregnancy.
Right.
So like I was quite large at 5 months and
Mm-hmm.
gave birth, and afterward I experienced breast milk.
Mm-hmm.
And I think that there's all these, like, um, effects that take place from going through a miscarriage. And
Absolutely.
I don't think we talk about that as often as we do in society, like
Mm-hmm.
that there are all these physical changes. So body image is definitely like a huge part of healing through
Right.
something like a miscarriage, and not having your baby in the end, but having, you know, like these experiences with your body. And
Yeah.
yeah, so thank you for commenting on that.
Yeah.
There,
Absolutely.
yeah, there's a question I have about intimacy and reestablishing intimacy in a relationship after going through something like miscarriage or birth trauma. Um, you know, because I've seen that be a major issue for couples coming
Yeah.
out of something so devastating, um, and going through that myself, and just
Mm-hmm.
figuring out how to come back together again when you have these feelings of loss associated with sex. And how do you support couples through that?
Mm-hmm. Yeah. It's one thing that often happens after a loss is that the let's say the pregnant person and the partner might be experiencing their grief at different times and in different ways. So it can be really isolating to feel like your partner's not with you in your grief. Um, in part because, and again, I'm brushing broad strokes here. In part because the person who has had the pregnancy loss, like within their body, and had to experience all of this, nobody else knows what that feels like. Your partner doesn't know what that feels like physically, and all of the complex thoughts and feelings and emotions that you're going through, they're looking at it from the outside. So already you're having a different experience. But additionally, sometimes I'll say that the partner can sometimes go into like action mode or stabilizing mode. Like in essence, as a couple, we still have to go to work or pay bills or do the day-to-day things. So they might go into like fix it mode or action mode, while the person who was pregnant might be deeper in their grief. And what we see a lot of times is that sometimes when the pregnant person comes out of their grief and they're doing a little bit better, the partner then starts experiencing their grief or their depression or whatever it is that they are going through. So there can be like this mismatch in the grieving process that happens. Um, that is what I understand from like the therapist side if I'm helping a couple. Um, but the couple doesn't see that or doesn't feel that. They're not like, oh, okay, we're going to be grieving at different times. It just can feel lonely, and it can feel like, why aren't you with me in this? Why don't we see things the same way, feel things the same way? Um, so it can not feel necessarily adversarial, but it can feel like we're not in this together. Right. So when there is a mismatch in grieving and grieving process, it can obviously feel hard to be connected, to feel like you're both experiencing the same thing. So, I mean, that's one big part of it, and not everyone experiences it that way. So I'm just giving you kind of one example, but um, for I guess what I'll say is for people who are pregnant and experienced a loss, as I kind of touched on before, there's a little bit of like mistrust of the body, um, or or even feeling disconnected from the body because like being connected and being grounded in your body can feel overwhelming, if you've gone through something like this. So just kind of skipping ahead to like physical intimacy with a partner can feel very, very different. There are could be multiple things like kind of going through somebody's head. And again, I'm just giving broad examples, but um, if you've been pregnant, you've had sex. Um, or if you're going through IVF, this is a different process. If you're spontaneously becoming pregnant, that's it has happened through sex. If you've gone through an IVF process and become pregnant through IVF or IUI or a way that uh, let me make sure I phrase this correctly. I'll say, or in a different way other than spontaneous pregnancy with a partner. That can bring on different sets of feelings. So I guess right now I'll just talk a little bit about spontaneous pregnancy, meaning that you became pregnant with your partner through sex. So in some way you are associating sex with pregnancy. So there can be in for some people like a fear of becoming pregnant again if they're not ready to be, um, or if their body hasn't healed or isn't feeling the same way that it felt before. So there can be kind of like an emotional wrestling with that. And it can feel to the partner like, oh, my wife doesn't want to have sex with me anymore. But it's usually much more complex than that. And it's not necessarily about the partner, although sometimes it can be, depending on the relationship. So right, that's kind of one example of why it could be complex to regain intimacy, because you're going through a process with your own body, and then if you're not feeling connected with your partner emotionally, it's just hard. It's just harder to be connected. There's a really great woman by the name of Emily Nagoski who wrote a book called "Come as You Are," and she also has a podcast now too. But in the book, she explains a little bit how different the sexual relationships can be between, let's say, again, I'll just go with a heterosexual couple with a male partner and a female partner. Is that in some ways, sex for a male can be, again, I'm generalizing, it can be like, they, let's say, just like think about sex, want to have sex, and are like in the mood. Oftentimes for a female partner, they don't really feel like having sex until they're having sex. They're And again, it's way more complex than this. I'm giving like a sketch of what she describes. Um, so in order to want to be intimate with your partner, you have to sort of be in a space where you want to be connected in that way. And sometimes you just don't feel that way until you feel the emotional connection with the partner. So because grief is really complex, and people are experiencing loads of different feelings, um, they may or may not, that I guess a pregnant person may or may not feel like having that type of intimacy because of how complex the internal emotional experience is. Um, but what I'll say is that most couples are not talking about this. It's just a felt sense of like disconnection or not wanting to or pulling away. And that would be, I guess, for the female or person who is pregnant. It your partner might want to have sex to be connected to you emotionally, and you might need to feel emotionally secure in order to want to have sex. So there can be this like mismatch. um, so it takes work, it takes communication, um, to and ideally to be open about how you're feeling and what's going on for you, mentally and emotionally. um, but I'll say with all of this, everything so far, even that we've talked about, um, sometimes you don't even know what you're feeling. It is Sometimes you don't know what you're feeling until you say it out loud. I mean, it can be really hard to name what it is you're going through, especially if you haven't gone through it before, if it's new to you. People suffer for a long time and can suffer for a long time. without seeking help, because the internal process might also be saying, you're going to be fine. It's fine. It's just a bad day. Or if I get better sleep, or, kind of trying to help yourself understand what's happening and help yourself cope through it. But sometimes we talk ourselves out of our feelings, that we shouldn't feel this way, that we should be able to deal with all of it somehow, without support and without getting help. Um, so it, any type of communication that feels supportive between partners can be helpful in moving the process along, the grief process along, to feel connected again.
Thank you, Dr. Kat. That's just so helpful for many people to hear these words and hear like that coming forward and speaking about it and actually like getting it out there to your partner and voicing it, even though we can't always find that language well.
Mm-hmm. Mm-hmm.
Doing our best to express that, I think, is the way to heal. Thank you.
Yeah. Yeah, it's helpful. Yeah, even you can even say things like, I don't know what I'm feeling, but I'm going to try to
Yeah.
tell you. And that can help reduce any kind of tension um, or stress in the
Mm,
couple.
thank you.
Hmm.
One last question for you today.
Yes.
What can our society do to offer more support for people going through pregnancy or postpartum mental health issues?
Oh, yeah, there's so much. There's so much that can be done.
Yes.
And I've sort of touched on some of it along the way. Social supports, feeling like you have a community of people who have your back, is
Mhm.
really, really important. Um, so, I mean, this could be like, expanding online support groups, or offering places for people to congregate, whether it's online or in person, to share their truths, to be honest with each other. Um, that it's known that social support is a big factor in helping somebody feel better through their experience. So that can be one on one, that could be peer to peer, or it can be in a support group. But having that one person that you go to, that you feel that you can like trust with your emotional experience, is really important, to not feel alone. Um, in part, what you're doing here, talking about it openly, um, giving people a place to come to listen and reflect on their own experience, is really important. Like the more people that are talking about this, the louder, the more we can increase the volume on this, the better. Because the stigma is still so strong about mental health in general. And then you add a layer of pregnancy that's supposed to be like magical and wonderful, and this is like your life's purpose, and all this other stuff that goes along with it. If we're having a real discussion, that other things exist as well, not saying that pregnancy can't be magical, they can, for some people. But there are so many other truths out there, and if we're only speaking to one possibility, it alienates everybody else.
Mm.
So, like having a platform like yours here, where people can access other truths, so that they can learn from that. I mean, um, and that's a different kind of social support, but it's out there and people can access it. um, I'd say there are other really big changes that could happen related to legislature and how people are supported during pregnancy and postpartum, extending pregnancy leave so that everybody has it. That's an incredible stress to have to like return to work in 6 weeks, those kinds of things. Like
Absolutely.
there are really big, huge logistical, law related things that we could change, policies we could change, so that it reduces the stress, reduces the overall stress load for people. Um, and well, I'm a therapist, so I'm pretty biased. Like everybody should be in therapy. I have a therapist. My therapist has a therapist. It that that kind of if we can create space for people to get the support they need, and you know as I said before, just really hold space, be compassionate and non-judgmental, um, and don't make assumptions about, what somebody's going through. At its, I guess, most fundamental, if we could just really be asking people, like, how are you really doing?
Mhm.
What's going on? You don't have to even know what's going on, but I'm here for you.
Mhm.
That goes a long way as well.
Mhm. Yeah. Thank you so much for joining us today, Dr. Katayune. Um, it's been very interesting and informative, and I've learned a lot from you, and I'm sure
Oh,
many
great.
people will too. Thank you.
Great, thank you. I'm glad to be here and talk with you, and I really do hope that people who are listening know that they're not alone and they can find resources for support.
Mhm. Thanks again. Take good care.
Thank you.